So, Dr. Louwers, you joined our team.
I did.
You took a big risk in coming to a brand new medical facility. Tell me a little bit about what intrigued you and why you wanted to join Reset Medical and Wellness.
I wanted to join Reset because I firmly believe that mental health is as important as any other aspect of healthcare. It's unfortunately often undertreated, underdiagnosed population. My background is in interventional pain management, and as you probably know, there's a lot of overlap between mental health and chronic pain. And I wanted to take my expertise in interventions and my experience and use it to treat this rather underserved population and get them back to a functioning life.
So when you learned about the Neuro Sympathetic Reset, what was your first reaction to it? Obviously, you hadn't heard about it used this way. Tell me a little bit about what your reaction was to it.
Yeah, it's really remarkable. We have used this type of procedure for years. It's been done for 100 years for pain management. It's commonly done FDA-approved treatment for certain types of pain, and we've used it that way for as long as I can remember. But now, just in the last few years, seeing some of the ways that we can explore other treatments, explore other diagnoses is amazing. I never thought it would have such a dramatic effect on such a wide range of diagnoses. And what's particularly remarkable, as opposed to a lot of conventional treatments that take weeks or months or unfortunately sometimes aren't effective at all, this treatment is effective almost immediately. We see results sometimes the same day. And that's so rewarding in medicine.
It is. It's pretty cool to watch. I mean, some people call me a week later and they haven't seen anything, and then all of a sudden they'll call me and say, "Wait a second, I just realized I wasn't doing this anymore," or
Right.
this has changed. But then there's some people that you see that wave of relief just come over them right away. And,
the energy comes back, their eyes light up, they're smiling or laughing or crying, like you say, but in a good way.
Yeah.
And it's really amazing to be part of.
So so far, I mean, it's been a couple of months, but so far, what has been the coolest reaction you've seen in all of the treatments? That immediate reaction.
I personally really like the laughing. I think laughter is so healing on so many levels. And to see someone who comes in, I talk to them beforehand, we're doing a little bit of a history, and they start to get tearful. And it's heartbreaking. And then after the procedure, within seconds, they're laughing, hysterically laughing, crying, laughing. And it just fills your heart and makes you feel like you're really doing something meaningful.
Yeah, I think laughter, we did have one instance where the person was laughing so hysterically that I did pee my pants. That was not good. But I mean, it was funny, it was good. But the feeling that I had when I first watched my girlfriend that hadn't laughed or cried in years, I mean, probably double-digit years, and seeing her immediately be able to cry and feel again and get out of that frozen state, probably for me was the most impactful, looking at that. But outside of my own personal hot flashes that are no longer there.
Yeah, and it's hard to relay that to other providers, because in medicine there's very few examples of that. I mean, even in cases of surgery where people are essentially treated right away, there's a time frame of healing. And yes, sometimes this procedure does take some time to take effect, but having that immediate gratification for the patient and the provider is amazing.
And obviously, you don't want to give everybody the hope that they're going to feel that right away, because sometimes it does take a week or two to have that download and the processing to change. So when I think of neurosympathetic reset, and I know I describe it in not the scientific way that you do, but I think of it like a reset of a computer. So the first thing that would ever happen when my computer would be running slow, or it wasn't processing correctly, or things weren't working right, I'd call the IT team and say, something's wrong with my computer. And the first thing they say is, have you turned it off and turned it back on? And I hate that, because oftentimes they're right. It's kind of like arriving at the doctor's office and you're no longer sick. But, when I turn off and turn my computer back on, all of a sudden it starts working better. And so when I think of like neurosympathetic reset, I think of turning off that sympathetic nerve for a period of time and allowing it to restart in a way that it processes better. So I think of it as like my communication channel going up and down, and instead of all of the things being stuck in the front of my brain constantly firing and I can't process it, it now allows me to compartmentalize those feelings differently, because those transmitters, or that reset of that sympathetic nerve, actually allows that processing to happen again. And so people don't realize what's happening. And I've talked to a gentleman that got a treatment, and he said that, he hadn't really realized that when he was processing through stressful or anxious moments, he's like, I still have them now, but I realize that I'm actually dealing with them better. It's not like the stress is gone. I mean, he still has the same stress of his job, but he's looking at things and he's able to cope with it a little bit better. So that's how I look at it, is like that reset of a computer, like it's our computer in our brain. But tell us a little bit about how it actually works scientifically, because that's my non-medical background version.
No, that's a great way to think about it, Kelly. In patients that have had a lot of chronic stress, severe traumas in their life, sometimes they form some unhealthy connections in the brain. And often in those patients, it's caused by a overstimulated sympathetic system. That's our fight or flight responses. And sometimes that's normal to have that fight or flight response, but when that's triggered repetitively, it can cause lasting changes. And it can affect all sorts of issues. It can affect hormone balance. It can affect your immune system, and it can affect the way you sleep. And it can lead to things like anxiety disorders and PTSD. The way our treatment works is it temporarily blocks that sympathetic system. That allows our brain to heal naturally, to some of those healthy connections to reform and to restore a healthy balance to our body.
Okay, so I know that when you and I have looked at things and we were doing the studies on, or looking at some of the studies, that they can actually see this firing in an MRI, like when they're doing a PET scan. So tell us what the difference is between like what a version of an MRI looks like on a healthy brain versus one that has had trauma.
So think of it this way. When these nerves continue to fire, they stimulate a chemical in our brain called norepinephrine. Think of norepinephrine like the gasoline that fuels our fight or flight response. And with constant stimulation, the brain is highly overactive, and it leads to things like hypervigilance, nightmares, attention deficit issues, and anxiety. And although our block is temporary, the brain wants to heal. The brain wants to return to a homeostasis, a natural balance. And that temporary block allows those chemicals to restore to their healthy levels, for healthy connections to form and to get resolution from a lot of those symptoms.
So it's funny that you say that when you said ADHD and like that calming of your brain, because I was talking to a patient that had it done and they said they were actually able to sit through a seminar and pay attention and not have to be thinking about all the other things, and that they hadn't really seen, it was about a week later, they hadn't seen like that dramatic effect sitting in the room where you have that feeling like that, but they realized that would have been something they never would have been able to do in the past, is to actually sit and listen to somebody speak for an hour straight without thinking they should be in like 10 different places. So that's kind of that, what you described to me when you said that. It reminded me of that description of that calmness, of that not constant firing.
Yeah, and what's amazing, we're seeing the benefits in all sorts of individuals. It's been originally, like I said, used for pain, most commonly studied now for PTSD as far as mental illness, but we are seeing improvements in patients with attention deficit, with obsessive compulsive disorders, other anxiety or depressive disorders, particularly treatment-resistant disorders, which is really promising. And as you mentioned before, there's other conditions that are seemingly unrelated, but can be extremely helpful in this situation, where things like long COVID, menopause symptoms, insomnia, which all relate to how our brain functions, healthy nerve growth, and our hormone balance, those can all be helped as well.
So tell me, just because I'm curious, the scientific side between why neurosympathetic reset works for menopause.
Yeah, so the way it works is a part of our brain called the hypothalamus is the brain that controls our body's temperature regulation, our homeostasis, if you will. And in people that are going through menopause, there's a dysfunction in our temperature regulation. And it's the same part of our brain that affects a whole bunch of different mental issues like anxiety and depression. So for the same way that it helps those conditions, it can help regulate issues with menopause.
With the body temperature going up and down. Yeah, because I know for me, not only did I feel much more calm, I didn't, profile for like PTSD or anxiety or depression, but I think when you're going through menopause, that constant change in your temperature and then your hormones and all of that, like you just can get a little irritable, and I've felt like so much more calm, in addition to the fact that I'm not having 35 hot flashes a day.
Yeah.
So.
Well, the same part of our brain controls all those emotions.
Yeah, so that makes a little bit more sense why I've had that kind of sense of peace about it, and a lack of hot flashes, which I greatly appreciate. Yeah. When you look out into the future of Reset, what's your hope for what we can do for our community? But I mean, we know we have people, we had somebody fly from South Africa to get the treatment done. So we know we can help people all over the place, but what's your hope for Reset?
Well, my hope is that we can just get the word out first. Mm-hmm. I think that's the most important thing. Even as a physician doing this type of procedure, I wasn't aware of its full potential. We have to get the information to providers and to potential patients so they understand that this is a new and novel way to approach these illnesses, and particularly in patients that haven't responded to conventional talk therapy or medications. It may be a really great option, and my hope is that we can get these patients back to a functional, healthy life, that they can, like you said, have their life back.
What I would love for you to do is to tell us a little bit about how it actually works, because a lot of people are like, I don't do shots, because they think it's a vaccine or something like that. And obviously this isn't that. And it's been something that has been around for, almost 100 years, right? And it's just being used differently. Obviously, I've described it in layman's terms, but if you could describe for us like how it actually works from a scientific way, in what we do during the treatment of neurosympathetic reset?
Sure. So the treatment itself is a very quick, safe, and effective treatment. A patient will be lying down, will numb an area of their neck. The part of their neck called the stellate ganglion is treated. That's the part of your nervous system that controls your fight or flight response. We'll numb the skin and then treat that with a local anesthetic called ropivacaine. It's similar to what you would see in a dentist office, like lidocaine or novocaine, but longer acting. It works long enough to pause that overactivity and allow our brain to then heal. The procedure is done using ultrasound, so that way I can see exactly where the medication needs to be placed, and it's the safest and most effective way to do this. The procedure takes about 20 minutes. Afterwards, there's some mild side effects that are expected. Tell us, in fact, that we've had a high quality block, and you can go home the same day and have no restrictions the next.
Yeah, so I've watched quite a few of these procedures be done, obviously, and had had it twice on myself. But some of the effects are, like the Horner's syndrome. So a lot of people will read it and be like, I don't want a permanent droopy eye. Well, it's not a permanent droopy eye, right? But it does, you get a droopy eye look that happens, and that lasts, anywhere from a couple hours to 8 or 9 hours. The next morning you wake up and it's gone. But that's the way you actually know that you got the block in the right spot, right? So even though it's a side effect, it's actually one you want to see.
That's right.
Yeah.
So these nerves control certain functions. And although temporary, like you said, for a few hours, you will have a droopy eye. We call that a Horner syndrome. You may have a hoarse voice or some local or regional numbness in your neck, shoulder, or arm. And that's all part of the procedure. It's expected. It tells us that we hit the right spot, and it wears off within 8 to 10 hours. By the next day, all those symptoms will be gone. You may have some localized soreness that can be treated with ice or Tylenol, but the benefits are lasting months to sometimes years.
Yeah, and I know for me, like one side, I didn't have any of those things other than the Horner syndrome. I had a little congestion in my nose, and then the other side, like my arm was like flopping around. It was kind of funny, but just for a couple of hours we made fun of it. But so each side even reacts differently, because you do one side on one day and one side the next, or following up within a short period of time. But allowing, just knowing that those things are expected, and that lump in your throat maybe when you swallow. And so tell everybody why we can't do it both sides the same day, and the difference between each side.
Sure. Everyone experiences the injection differently, but there are some anatomic differences from one side to the other, and everyone's anatomy just in general is a little bit different from right to left. There are some nerves that will be inadvertently numbed, and that can cause some feeling of hoarseness or difficulty swallowing, although those aren't any significant concerns. But it is the reason that we do one side one day followed by the other side on a subsequent.
Yeah, because if you had that feeling of swallowing and you did both sides, it would probably be a little bit scary.
That would be more concerning.
Yeah, more concerning. So I know you said that it can last for months to years, and everybody's a little bit different. Sometimes once you kind of reset that, it's just reset and you don't ever have to do it. But there are people out there that are going back into the traumatic situations over and over, which is one of the reasons why we have a pretty large discount for first responders, military, teachers, nurses, because when they come in and they get treated, such as my son, let's just say he comes in and he gets treated from these traumatic events that he's been through as a fireman, but he goes back out and he's still a fireman. Like, he still has to go back out into those events, although he will tell me he processes them completely different now than he did. But there could be that buildup of stressors over a period of time that cause the sympathetic nerve to, continue to get bound up or tightened, or however you want to describe it. And they may need to have some ongoing treatment, but then there's people that have had it and 18 years later are perfectly fine and haven't had to have another treatment. So kind of give us the science behind that and why maybe it would work sometimes one time and sometimes people have to have it over again?
Well, truthfully, we don't always know. We can't really predict. As you said, everyone experiences it a little bit differently. We find statistically that patients that have moderate to severe PTSD tend to respond best. But again, we see responses in patients with many conditions and many severities. If, yes, you're going back into circumstances that increase those stressful events that start to return that regular fight or flight response and your sympathetic system is once again overactive, it can lead to the same maladaptive changes, the same chemical changes in our brain that caused the event in the first place. And so we always recommend that if you're going to be in that situation, both that you may want to look at other conventional treatments, ongoing things like talk therapy or following up with your doctors for medication treatment if needed, and that yes, you may need to come back and have the procedure done again, be it months or years later if those symptoms start to return.
Yeah, and I know obviously we offer ketamine here. Tell me a little bit about when ketamine would come into play related to kind of that healing process.
Yeah, so ketamine is used for what we call treatment-resistant depression, or TRD. It's done in a series, typically, of infusions over the course of 3 or 4 weeks. And in patients that have failed at least 2 treatments, so for instance, cognitive behavioral therapy and a medication, they would be a good candidate to consider ketamine. And the way ketamine works is it increases a chemical in our brain called glutamate, which is kind of a happy chemical. And
I like happy chemicals.
Yeah. And so we find that patients with chronic and severe depression, major depressive disorder, and treatment-resistant depression often have very low levels of that chemical, as well as some others. And by increasing that, we can see sometimes immediate response in these patients. And often these patients will then respond subsequently much better to some of those other treatments that had previously failed.
Okay. So if somebody said, do I start with Neuro Sympathetic Reset? Do I start with ketamine? Like, what do you recommend?
Well, it might be a discussion to have with the patient or with their doctors. In general, in patients that have really severe depression, certainly patients that are suicidal, they may need to have the ketamine first. In other patients that have a broader range of symptoms, anxiety, depression, PTSD, some combination of those, they might respond better to having the NSR first, and then following that, seeing how they respond, and perhaps if needed to treat more severe depression, ketamine later on.
Right. And so what I've seen, at least in the patients we've treated so far, is in hearing back from some of their therapists is that they actually can process better during therapy. So we don't recommend that they don't go to a therapist or continue their therapeutic treatment after NSR. It actually kind of helps to extend the life of it. But the processing becomes a lot better, and then seeing where that depression ends up and whether or not their mental health provider then thinks they need ketamine after that, or to continue, like some people coming already on ketamine, and then figuring out whether they need to continue that. So is that pretty much how you view it as well?
I would, yes. If they are doing well after a treatment, and they can continue some of those other therapies that, like you said, may benefit more. They may not need to come back, or they may need to only touch base occasionally. But again, something that would be followed with us and their regular doctor.
So speaking of following, we do a series of assessments leading up to it to kind of get a baseline of where they're at from a mental health perspective. And then we continue to follow them up over a period of time through It's like an app. It's actually on the web, but they get a text message they fill out continuously, like right after they have the treatment, a week after, 2 weeks, and then like every month for 6 months. And then we continue to follow them through a couple of years. But what we're seeing in that is pretty dramatic improvement. And those are assessments that are used in mental health all over the place. So PCL5, GAD-7, PHQ-9. Tell us a little bit about like how we're going to follow them throughout that journey.
Yeah, it's important for us that we not only treat these patients, but we make sure that they're not relapsing or, like we mentioned earlier, having another event that triggers some of these negative effects. And so before they're treated, they take assessments including the PHQ-9, which is for depression, the PCL5, which is to assess PTSD, and the GAD-7, which assesses their anxiety, along with some other scores. And that's then followed the week after their procedure, the month after, almost monthly out to about a year, and then even out to as far as 2 years or more. But most importantly, if we're seeing any change in their score that's negative, that's not going better, we're going to contact those patients. We're going to want to touch base with them, understand why that's occurring, if they think they need help with that, getting them into counseling or getting them back here for more treatments.
Right. And I think that that's important because it's like a mental health tracker, or like a fitness tracker that acts, but for your mental health. No
right.
different than you would track your fitness. This
Right.
is actually tracking your mental health. And so when you start to slide down, it's either, okay, maybe you need to increase the amount of talk therapy that you're doing, meditation, or maybe it's time for another treatment, but we can look at that together, which I think
That's right.
is super cool. So,
Yep, absolutely.
That's awesome.
Yeah.